everyone, I'm Mrs. Princey, Associate Professor in Mental Health Nursing. You have already learned about the alcohol dependence syndrome in the previous videos. So today I'll be dealing with the nursing management of client with the alcohol dependence syndrome. So when there is a client in the inpatient department, so as a nurse, you're giving a care to the client. So what is your responsibility? How would you manage such a client with the alcohol dependence syndrome? So as you know, we follow the nursing process. So we have got the nursing assessment, the nursing diagnosis, planning the goal, planning the interventions, implementation, evaluation, right? So let us see the first step in the nursing process, that is a nursing assessment. So when there is a client with the alcohol dependence syndrome, it's very much necessary that you need to do the assessment for the client. So there is a subjective data as well as the objective data that you're going to do in the nursing assessment. The first thing is the subjective data. We have got a set of the questions that you may require to get an answer from the client to have a diagnosis, right? So we have got a questionnaire known as a cage questionnaire. So you're going to question the client based on these few topics, right? The keynotes. So what is this cage questionnaire? Okay, C. So the alphabet C corresponds to the question as you're going to ask the client, have you ever ought to cut down the drinking, right? So have you ever had a thought to cut down your drinking? So that is the first alphabet, which is C, cut down. Have you ever had the thought to cut down the habit of drinking? So patient may respond to it like, maybe he had a thought, or maybe he's not having any thought, or is against the thought of it. So whatever the responses you get, so you're going to have a scale and you're going to do the assessment and you're going to do the diagnosis. So far that's the first alphabet C. The next one is A. So A, what are the questions that you're going to ask? Have people annoyed you by criticizing your habit of drinking? So A is related to annoying. So as the client anytime been annoyed by the people's reaction related to the behavior of drinking, that you're going to ask. Next is the G. You're going to ask a question to the client, have you ever felt the guilt of drinking, right? Next is E. So E, you're going to ask a question, have you ever had a drink first thing in the morning as an eye opener, right? There are clients who just to get over from this hangover, they first thing what they do is as soon as they open the eye, wake up in the morning, they take a drink. So as the client having this kind of a habit, okay, eye opener, a drink as a eye opener. So based on this cage questionnaire, there will be some questions related to cutting down of drinking or annoying the person, or it can be the guilt feeling questions, or it can be the eye opener questions. So based on these four alphabets or the cage questionnaire, there will be a set of questions that the client may have to answer, and based on that you're going to find out whether the client is dependent on alcohol or not. Apart from the cage questionnaire, you're going to ask other questions related to the difficulties that the client is facing or the problems that the client is facing. It can be the family related problems, work related problems, or any kind of problems related to the finances or the law. So anything the client is currently undergoing, the difficulties or problems or concerns related to the family difficulties or law or any kind of work related difficulty, you're going to question the client about it. You're going to find out by asking the client the withdrawal symptoms that he is experiencing when he stops taking the alcohol, if the client is experiencing any kind of the withdrawal symptoms. You're going to ask questions related to alcohol-related physical problems. So, any kind of physical problem the client is experiencing currently, okay, that you're going to ask the client. You're going to get the history of accidents, previous accidents, repeated accidents, repeated traumas that he experiences in his life, that you're going to collect. So it gives us an idea that it can be because of the effect of alcohol. You're going to find out if the patient is having the deliberate self-harm. Anytime he had any kind of the, suicidal attempts or suicidal plans or suicidal ideas, the deliberate self-harm, behavior whether the client had, you're going to find out. Apart from these, you're going to clinically find out, by doing the observation, you're going to find out whether the client is only having the alcohol abuse or he is abusing any other drug also. So how would you find out? You're going to look out for some kind of a signs which can make you feel, suspicious that he is having other drug abuses, like needle tracks or any kind of thrombophlebitis in the veins. If the client is wearing a long garment, okay, so a long sleeved dress or shirts, which may give us an idea that he is having some problem related to the puncture or the vein. It can be thrombophlebitis or infiltration, subcutaneous abscess, or any kind of hepatitis. All these gives us a ideas that he may have a abuse to other drugs also. So always be very much vigilant to observe such kind of a peculiar behavior wherein the client may just hide it under his garments. You're going to observe for the behavioral changes wherein you're going to find out if the client is absent from the school or from the work area frequently, is having a poor grooming, whether he is having any kind of criminal offenses, whether he is isolated from his friends or families, or has he got a new gang of friends who have, wherein he has just got into it, wherein they started abusing the alcohol or drug. What is a new friend gang that he has got? So all these assessment that you're going to find out to just rule out the changes in the behavior. Certain laboratory tests that you're going to observe, okay, so various blood tests that the client would have underwent, like the alcohol intoxication, the level of alcohol in the blood, urine toxicology tests. So such kind of a blood test that you're going to have a look at. You're going to do a physical examination, head to toe examination system wise, wherein you're going to find out the various problems in the different systems. So in the GI system, you may ask the client for if he is having nausea, vomiting, or if the client is having changes in the weight or appetite. You're going to check for the signs of malnutrition, color and consistency of the stool. So that's in the GI system that you're going to assess. In the nervous system, you're going to assess for the level of the consciousness, the orientation. You're going to check for the coordination and the gait. You're going to check for the signs and symptoms of memory loss, signs of depression, anxiety, changes in the pupillary reaction. So all these that you're going to observe and do the examination in the nervous system. The next is the cardiovascular and respiratory system. You're going to do the assessment to find out the pulse rate, respiratory rate. Is the patient having any kind of a difficulty in the breathing, any changes in the ECGs, abnormal breath sounds or arrhythmias, or peripheral edema. If the client is having, you're going to observe that. Next is the integumentary system. In the skin, you're going to observe for any kind of the lesions or any kind of a crack on the skin, which can be because of the needle puncture, or any kind of the scars on his arms, legs, toes, fingers, under the tongue, between the gums or the lips. So you're going to rule out that, which is going to give you an idea. Apart from the alcoholic behavior, is the client having any other drug abusing behavior, right? So you're going to observe the integumentary system. You're going to observe the emotional behavior of the client. What is the emotions or mood liability? Is the client having irritability, agitation, violent behavior, hostile behavior? Going to find out the emotional behavior of the client. You're going to assess the speech of the client. It can be the rate of speech, or if the client is having a slurred speech, where if he becomes anger, agitated, suspicious, is he experiencing any kind of the hallucinations, kind of blackouts or violent episodes if the client is experienced. So these are the assessment in the various systems that you're going to do, and you're going to rule out if there are any changes in those systems. Apart from this, you're going to find out what is the habit of taking the substance. So identify what kind of a substance the client is taking, what is the amount, the frequency, method of administration, and the length of the time that the drug is being used. For how long is the client been using this particular substance? It can be alcohol, it can be any kind of the drug also. Also, you have to assess the level of motivation for quitting this particular substance of abuse. So what is the motivation that the client is having? Is he self motivated, or is it that he is being forcefully bought into this de-addiction center? So what is it, what is the motivation factor that he is having, which is really going to help out in abstinence? So identify the reason why he is there in this particular hospital. What is the reason for admission, right? Whether it is for the treatment of withdrawal symptoms, or it is for treatment of acute intoxication, or is it because of for the treatment of the complication, or is it the reason that he wants to completely stop the behavior of alcoholism or drug abuse, or is into abstinence? So what is it that he is admitted for? So the reason for admission you're going to assess. So these are the few important things when you're doing the nursing assessment part, the subjective as well as the objective data that you're going to collect. So the next step that we have is, based on the assessment, you're going to diagnose what is the problem of the patient. So we have got the list of nursing diagnoses that you can state for a client with the alcohol dependent syndrome. The first diagnosis is the ineffective health maintenance related to inability to identify, manage, or seek out the help to maintain the health, as evidenced by various physical symptoms, exhaustion, sleep disturbance, etc. So that's the first nursing diagnosis, ineffective health maintenance. The next we have ineffective denial related to weak and underdeveloped ego, as evidenced by lack of insight, rationalizing the problems, blaming others, failure to accept the responsibility for his behavior. So that is a next nursing diagnosis that you can state is the ineffective denial. The next nursing diagnosis we have is the ineffective individual coping related to impairment of adaptive behavior or problem solving ability, as evidenced by use of substance as coping mechanism, right? So ineffective individual coping to various kinds of the problem. Because of the ineffective coping, he may use substance abuse as a coping mechanism. So that is one of the nursing diagnoses you can state. Next nursing diagnosis, we have anxiety related to irrational thoughts secondary to absence of the support system. So when there is a poor support system, no friends, no family to support, obviously a client becomes very much anxious because he is getting all such ideas or irrational thoughts. The next nursing diagnosis we have is disturbed sensory perception, that is the hallucination if the client is having related to altered mental status. Next nursing diagnosis is impaired verbal communication related to incoherent speech pattern and side effects of medication. The next important nursing diagnosis is imbalanced nutrition less than body requirement related to anorexia secondary to alcohol dependent syndrome. So you understand that the client will have various degrees of malnutrition. It can be protein deficiency or vitamin deficiency, mineral deficiency, can lead to changes in the weight. It can be weight loss and loss of appetite. So because of which you state a nursing diagnosis of imbalanced nutrition. Next nursing diagnosis is disturbed self-esteem related to dependence, disturbed sleep pattern related to the emotional disturbance. The next nursing diagnosis we have knowledge deficit related to alcohol dependence, the treatment and its effects. Okay, so that is the knowledge deficit nursing diagnosis. The next one we have is risk for injury related to hallucinosis, acute intoxication. So these are the various nursing diagnoses that you can state for a client with the alcohol dependent syndrome. Moving on to the nursing interventions. The nurse who is taking care of such a client who is there in a de-addiction center should have a basic knowledge related to the problem, right? So she should be well versed related to the alcohol related problems and any other drug abuses. She has to know, have a complete knowledge about the problem. First thing. She need to realize that the alcoholism is not a one day disorder that the client is having. It's a chronic dependence that the client is suffering from, and there are chances that the relapse can happen anytime. And this particular disorder or the disease, it's not only going to affect the physical life of a person or the physical health, it's going to affect the overall areas. It can be physical, mental, spiritual, the societal, family. So it is going to have an impairment on all the areas in the life of the client. And important thing is it's not only the client who suffers, but the family as well, and the community as a whole is going to suffer. So this is the basic knowledge that the nurse should have when she is caring for a client in the de-addiction center. The foremost important thing that the nurse should do is to accept the client exactly as he is, right? Many alcoholics have this idea that, people deny them. They are not accepted by the society. So it should be the same with the nurse. So nurse should be the one who should accept the patient exactly as he is, so that the client should not deny that, he cannot be accepted by the people. So the care should be rendered in such a way that you welcome the client. So care should be rendered in such a way that you accept the client as he is. Even though they are prone to various manipulative behavior, at times they become very violent. You cannot even predict how the reaction or behavior may change. So as a nurse, you should be in a place to accept the client, and the client should feel safe in your hands. Immediately after the client gets admitted, so during the acute phase of the treatment, so you're going to give a detoxification therapy for the client. So what is the nurse's responsibility there? See to it that the client is being kept in a safe environment, low from the various stimuli. It can be the light, the noise, the odors, so that the patient doesn't get agitated, feared, or it doesn't have any kind of hallucinations or illusions. So the environment of the client should be the foremost important thing, which should be very much comfortable for the client. See that you take safety precautions when the client is there in the environment. He may have, at any time he can have the self-harm behavior. So see to it that the environment is safe, away from all sharp equipments, ropes, any kind of furnitures that can harm the client can harm himself, okay, or others. So all such things should be taken away, and the environment should be very much safe for the client. Carefully observe the client for the changes in the behavior or any withdrawal symptoms if the client is developing. It can be delirium tremens, which is an emergency condition. Management is required immediately. So observe for such kind of the complications or withdrawal symptoms which can happen. Make sure that when the client is on the bed, the side rails are up. Okay, anytime he can have any kind of the reactions, or he may have fits, or he may become very much hyperactive or disturbed. See to it that the client is being protected when he is very much hyperactive, because he can harm himself as well as others. At times the physical restraint may be necessary when the client behaves in a violent way. Monitor the vital signs every 15 minutes initially, so that you can find out if there are changes in the heart rate or respiratory rate, temperature. You can do the management immediately. Frequently orient the client to the surroundings and to the reality, because in such kind of a patient there will be a problem in the high mental functions. So when medications are prescribed, see that you educate the client to follow the medication regimen as the prescription, not to miss any the dose or the medication, and to strictly adhere to the prescription. At times, the client may receive the anti-anxiety medications or benzodiazepine group of drugs that to just calm down the client's parenteral route injections may be required. So, see to it that you administer those. The patients may also get the vitamin supplements, especially vitamin B1, B6, B12, vitamin B complex tablets, and vitamin C tablets, so that the immunity of the client can be maintained, and also nutritional deficiency can be avoided. If the client is having gastritis, the antacid group of drugs can be prescribed. If the client is having fluid and electrolyte imbalance, IV fluid or replacement therapy is necessary. So that is related to the medication. Coming to the nutrition, very important. The client should have adequate nutrition, because he may have an imbalance to nutrition. Document the intake output chart and monitor the weight daily. Ensure that the client receives small and frequent diet rather than the larger meals with adequate calorie intake. You can encourage the family members to get the food which is home cooked, or which whatever the client likes. So consider the likes and dislikes of the client when the nutritional status has to be improved. Apart from the diet, even the rest is very important. The grooming of the client, the personal hygiene is very important, right? So see to it that you encourage the client to do all the personal hygiene, take adequate rest, and revive himself to recover from the particular problem. Involve the client in various activities which happens in the ward, so which can give a chance for the client to socialize with others, and also have a diversional and recreation from the thought of this particular behavior. Since most of the clients will be having a very low self-esteem, it depends on the nurse as to how to it depends on the nurse as to help the client to overcome this low self-esteem by interacting him and accepting him and motivating him, wherein he feels a little bit boosted and motivated, where his self-esteem can be uplifted. Make sure that the nurse make sure that you're empathetic towards the client and not being very sympathetic, so that the client is not dependent on you every time. So whenever there is a psychological therapy or various psychotherapies, see to it that you assist the psychotherapies, and also you encourage the family or the wife, the spouse, to get involved in the various therapies if indicated. Motivate them to give a support to the client, so that the client will be able to recover from the no problem very quickly. Now, what is the nurse's role in prevention of alcohol abuse? So we have got the roles in the primary prevention, the secondary prevention, as well as the tertiary prevention. So in the primary prevention, the goal or the aim is to reduce the new cases of the alcohol abuse by reducing the consumption of alcohol by certain methods. So it can be health promotion or through education. So you as a nurse should work with the community, educate the community related to the health promotive measures by reducing the consumption of alcohol, which eventually makes the client to have the reduced number of new cases of alcoholic addiction, right? So that is the first thing that you're going to do in the primary prevention, the mass health education and health promotive measures that you educate to the public about, and also prevent the consumption of the alcohol. Moving on to the secondary prevention. So, in the secondary prevention, as a nurse, you're going to detect those cases of alcohol addiction and you're going to give them the treatment so that the complications of the alcohol dependence syndrome can be avoided. So, you're going to identify those cases, you're going to give them the treatment. It can be the detoxification or the symptomatic treatment so that the client will not develop the complications because of the alcohol abuse. The next The next one is the tertiary prevention. The role of the nurse in the tertiary prevention is to avoid the further disabilities which happens because of the alcohol problem, and also to reintegrate the individual who have already been addicts to the society. So you're going to bring those alcoholic clients back to the previous level of functioning in the normal way. You're going to put them back in the society wherein they get all their self-esteem improved, they feel confident about themselves, they feel motivated so that they can lead a normal life in the society. So that is what you're going to do in the tertiary prevention, wherein you're going to reduce the further disabilities and you're going to reintegrate those people who already been addicts previously into the society so that the society is free from the alcoholic related problems, right? So this is the role of a nurse in the primary, secondary as well as the tertiary prevention. Right. So when you take the nurse's responsibility or the nurse's management, very, very important to identify the case by doing the assessment, identify the various problems the client is undergoing, plan the interventions and deliver the care to the client in an effective way so that the client, his family, as well as the society as a whole can be benefited and the society can be uplifted. Hope you all have understood the topic. Thank you.